Now, imagine the whole exome. When we're talking about carrier screening, you can see sort of the size of the exome we're talking about. So I mentioned before, there's about 2,200 known recessive and X-linked conditions. There's a whole lot we don't know yet, a whole lot of, we call them variants of uncertain significance and different mutations and even sequences that we might not exactly know and understand. But specifically talking about carrier screening and CGT, which is Igenomix Carrier Genetic Testing, our carrier screening product, our CGT exome-based approach is, again, just a piece of the whole exome picture. All right, so let me explain how CGT exome and how Igenomix uses an exome-based approach. So imagine every sample that comes through the door at Igenomix, whether it's a saliva sample or a blood sample from a patient, a donor, it doesn't matter. The sample comes in, we extract the DNA, and we run exome sequencing. So we capture the information from all 2,200 genes for every single sample. And then we apply different bioinformatic filters. And the first one I'm showing you here is what we call CGT+. This is our Igenomix curated expanded carrier screen. We chose the genes. We curated this list, this panel. This expanded carrier screen, CGT+, does include the ACMG tier 3 genes that Rowan talked about a minute ago. This panel, if you'd like to call it, this curated expanded carrier screen contains 535 genes in the female, 474 in the male, and so 65 of those are X-linked. This is an excellent choice for patient partner being tested at the same time. You'll get a report for patient, a report for partner, and of course, an evaluation of the reproductive risk between those. It's also a great option for intended parents. So speaking to the third-party people that may be joining us today. If you're trying to screen your intended parents before they select a donor, I think which quite often happens, you do, that's one of the first things you do is do a carrier screen on the donor, on the intended parent. CGT+ is a great option. It's a very well curated expanded carrier screen. Another option that we have is called CGT Mirror. So again, imagine we've got all this data sitting here. What bioinformatic filter are we going to apply? What are we going to report? And CGT Mirror is extremely unique and really a powerful option. Essentially, we can mirror the common gene panels that exist on the market, but also gene panels that are no longer on the market. And so I'll mention Semaphore, I'll mention Invitae, providers that unfortunately have left the market for different reasons. But we know that there are tanks and tanks of gametes, sperm and eggs that have been screened with these panels, with these providers that are no longer on the market. And with CGT Mirror, we can overcome that issue. We can mirror those exact panels. And so this is a CGT Mirror is a great option for intended parents when you're working with a donor bank where you know the gene panels that donor bank typically works with. So you can choose your CGT Mirror options from that list. Or if you have an intended parent who's already chosen a donor, or maybe they're using a known donor, a directed donor, and where that donor's already been tested, and in your hands you have that carrier screening report. This is a great option. This is a great use for CGT Mirror because you can order a mirror of that panel, and you can avoid running into that situation where one person is positive for something that the other wasn't tested for. The classic issue with carrier screening that Rowan highlighted. And last but not least, we have another option, another type of filter that we can apply to the exome data, and that's called CGT Sequential. CGT Sequential is single gene testing of 1 to 10 autosomal recessive genes. We quite often get asked, my patient just needs tested for, pick your gene. Can you test for just that one gene? Yes, absolutely we can, and that's CGT Sequential. The great thing about CGT Sequential is we can test, as I said, for 1 to 2 single genes, but we can also include the 65 X-linked for females. This is a great choice for a sequential testing scenario, hence the name of the test. So if one person has already done a carrier screen from any provider, maybe Igenomix, maybe another, They only want to test the reproductive partner for the genes that the first person was positive for what they are known carriers of. In the case where the already tested individual is male, the person doing the sequential is female, you can see where the utility would come in of ordering the single genes, but also the 65 X-linked genes. And so we're not limited to just those three sort of options I told you. And I just want to emphasize that another true benefit of an exome-based approach is this option to customize. What do you want in your clinic, in your donor bank, in your facility? What do you need to screen for? We have complete flexibility here, and we can help you. We can add genes and remove genes as necessary. We've had requests, for example, medical geneticists that have reviewed our CGT Plus option, and they've said, listen, I really like this, but could you remove this gene and maybe add on these additional two? Yes, absolutely, we can do that. And we have the support and guidance available if you would like to rely on us to help give you some expertise in building kind of your own custom options. One that I'll just mention, and Rowan talked a bit about the ACMG Tier 3 option. Typically, donor banks are sort of leaning away from those smaller type panels, but that's an example of a custom option that we have available or that we could help you build. So really tremendous flexibility does exist. I would be remiss when I talk about the exome-based approach if I didn't emphasize the possibility and the power of upgrades. As you know, we mentioned, if you've chosen a fixed gene panel, a closed gene panel, you're stuck. You can't retest the donor if something else needs done. You can't get another sample from the donor. It's not always possible. Or yourself, if you've done a test, you're kind of stuck. If you need information on another gene, you might have to submit a new sample, pay again, wait a long time to get those results. Not with CGT, with Igenomix. Because we've captured all your data, your exome data, we can upgrade, we can give you information on new genes at any time. And so we can do that with a plus, with a mirror, with a sequential, with your custom option that you've chosen. So I've given you an example here. Imagine a female patient. She's done a CGT plus. So we've reported 539 genes. But remember, there are about 2,200 at the present time known autosomal recessive and X-linked genes. So if we subtract the 539 we've looked at, there are approximately 1,661 other genes available to upgrade. So imagine this patient in my scenario, imagine she's an intended parent and now she's choosing a donor. And all of a sudden she sees her donor is positive for something that wasn't included in her initial test. No problem. We can upgrade her sample. We can go back to that data that we have and report out on the required gene. We can do it quickly, and we don't need a new sample. And so this is really a benefit of CGT, that we can offer these upgrades. Imagine then the same patient 2 years from now chooses a different donor altogether and needs another gene looked at. Again, no problem. We've got this ability to upgrade. We're not talking today about our Igenomix clinic portal, but all of these options are available to order on the portal, and upgrades are available to request on the portal as well. Last but not least, I want to just touch on CGT matching reports, and Dr. Alyssa Snyder is going to talk more about our matching reports in a few moments, but I just need to emphasize them here because, again, they really are a really powerful tool that CGT exome based carrier screening brings. And so basically what we can do at Igenomix is, and I have an example here with donors and with an intended parent, but you could have patient partner, you could have donor intended parent. There's so many different, just sperm source, egg source, think of it that way. And so in my example here, you've got a donor, they have a carrier screening report associated with their profile. Maybe they did a CGT with Igenomix, or maybe they did any other carrier screening test, it doesn't matter. Then on the other side, we have the intended parent. And again, they've got a carrier screening report in their hand, might have been CGT with Igenomix, but it might have been any carrier screening test. As long as one of these sperm source or egg source did an Igenomix test, we offer matching reports. We offer this service where we assess we look at the reproductive risk. And so on our portal, you have the ability to upload a previously tested individual's report and ask us to link it to the person or the test that was done through Igenomix, and we can create these matching reports. And this is a very unique and very powerful advantage to CGT with Igenomix. So in summary, I just want to highlight again the main benefits of an exome-based approach before Alyssa Snyder takes over and goes into a little bit more depth. But first of all, on the clinical side, on the clinical advantage, we are able to test for all known recessive and X-linked conditions. Because remember, every sample that comes in, we're running whole exome sequencing on that sample. The increase in the overall detection rate that we achieve with exome sequencing helps minimize the global residual risk. I touched on CGT Mirror, that option where we can actually mirror or replicate all common carrier screening panels and really close those gaps that have been left open in the market. Avoid those situations where someone tests positive for something the other wasn't screened for. Upgrades also help with that because we don't need a new sample. We can go back to that data at any date and upgrade and curate and release information on any gene at a later date, which really brings tremendous flexibility for donor banks and third-party programs alike. And last but not least, the matching reports that I just mentioned, where we assess the carrier screening reports of a reproductive couple and provide a match report. And that can include 2 Igenomix tested individuals, absolutely, but also an externally tested individual with a CGT from Igenomix report.